Welcome back to BetterHelp's In Session series. I'm Haesue Jo, and I'm a licensed therapist and part of the clinical operations team here at BetterHelp. Today, I'm super excited to be joined once again by our friend, Dr. Courtney Tracy. USC-trained psychotherapist Dr. Courtney Tracy, also known as the Truth Doctor, is recognized as one of today's most authentic, perspective-shifting voices on mental health, and one of the first therapists to publicly disclose her own mental health disorders. As a multi-hyphenate healthcare entrepreneur and award-winning content creator, she has founded 5 mental health companies, and her work has garnered more than 100 million views. Learn more at thetruthDoctor.com or by visiting at the.truth.doctor on TikTok, Instagram, or YouTube. Dr. Courtney, as usual, thank you so much for being part of our In Session series. We're super excited to have you back on here. And I know it's been a little bit of time since we've last spoken. I imagine a lot has happened, so I want to ask and check in with you how things have been.
Yeah, well, it's so nice to be on here again. 3 of the really big things that has happened since we last spoke was I opened up a new treatment center, and
Congratulations.
thank you. And I finished writing my first book, and I had my second baby.
My gosh, tons have happened there.
A lot the last 12 months. I called last year my book baby business year.
Yeah, I mean, I can't imagine doing all that stuff with a baby. And I think that's actually a pretty good segue into some of the stuff that I think we wanted to talk about today. You mentioned that you were passionate and interested in talking about maternal mental health. I can't imagine doing that with a baby. And I think that's because of, this burgeoning topic of postpartum depression and all kinds of things that can come with having a baby, just the difficulties, the challenges, emotionally, mentally, not getting as much sleep. It's also just something that so many people can relate to, and really eager to get into it with someone with firsthand experience going through it right now. Would love to just hear some general thoughts from you before we kind of dive into some deeper discussion around it.
Yeah, absolutely. When I had my first child, it was a very easy experience. It didn't really affect me mentally or physically. When I had my first child, I also was opening up a different treatment center at the time. And so when I was thinking then about being a mom and doing the business thing at the same time, it felt like I didn't really get the experience of what would make it difficult my first time around. This time around, it has been very difficult. And the reason for that is mainly because I did experience mental health concerns. I had a lot of physical health issues, physical pain, etc., while I was trying to still live my life, function, open a business, and write a book. I bring up those 2 different examples so that moms that are listening, or anyone that are listening for moms, if the first experience is good, it's knowing that the next one may be different, and vice versa. If the first one is difficult, the next one may be and likely will be a wildly different experience. And so you never know really what you're going to get when you make the decision to become a mother, or when you find yourself in a position where you are pregnant and are creating a life within you. It's ups and downs. And I love that we're having this conversation, because in today's age and time, people who have children using their bodies still also have to use their bodies to work, to do household chores, to go to school, to raise other children while they're making a child. And it's something that I think, well, one, it's required for us to continue to thrive as a species to a certain extent. And many of us want to do that in our personal lives as well. And the balance is perceived, I think, by many to be easy who don't experience it themselves. And it isn't easy, it's hard. And I think that more people should understand that it's normal to have difficulties in the maternal phase.
Thank you. It's been going on since the history of all time, right? That people are giving birth, that people are having to, heal from this so that, like, physically, so that they can continue on raising these kids, or, moving through work, school, family relationships, other things going on. And somehow it's topics related to that, making it challenging, have not really been encouraged until fairly recently. So I think it is a pretty relatable experience to feel like, oh, I can't talk about this because everybody else is doing such a good job. Everyone's so happy in this period of life. And is there something wrong with me for not being super happy, or not feeling super bonded, or not feeling all the ways that I think I'm supposed to? I think it's something important to be said that, according to the American Psychiatric Association, 1 in 5 expecting or new mothers or people who give birth experience a mental health or substance use disorder during the perinatal period, the time spanning pregnancy, and the year after birth. Additionally, the Maternal Mental Health Alliance cites that 70% of expecting or new mothers will hide or underplay maternal mental health difficulties. I kind of alluded to some of the social reasons why that might be, but I'm curious to hear now where you think some of that might stem from.
Yeah, well, it's so disheartening to hear the statistics because anyone who has been pregnant or had a child knows that all you want is for it to be the best possible experience. And the amount of people who have difficult experiences, it's just no one wants that. And it's such a critical time period, and you never forget how it feels. And so I just, sympathize and empathize with people that have been in a similar situation to me and a different one, because it's their own experience. And when it comes to not talking about it, how you're feeling, what's happening with you, it makes a lot of sense that society plays a major role in it. I mean, we can just simply look at work hours, general work hours, 9 to 5, certain amount of income that people are making where they can't take an extended a period of time off. They have to go back to work, even though they're still struggling physically, likely still struggling mentally, and perhaps struggling financially with a new child in the house, new responsibilities, and so forth. But I think it goes a lot deeper than society. I think if we take a look at even family systems and try to, understand how people are perceived in terms of their gender roles, the hierarchy that's in the household, who makes the money and who doesn't. And it all plays a factor into whether or not the person who just gave birth gets permission to rest, to breathe, to return to themselves. And I also think it has to do with the individual. I think that what we tell ourselves about this time period is something that does affect our outcome. If we tell ourselves, based off of all the messages that we've received, that it's supposed to be easy, we're supposed to love it, we're supposed to have an immediate bond, then we do turn to, what is wrong with me? Why can't I figure this out? Why am I the only one that seems to not be smiling at the park, or have a clean car, or be able to not have my kid have food all over themselves, or whatever it is? It's so easy for moms to point out in their environment things that they wish they could do when they're struggling as a new mom or in pregnancy. So it's individual, it's family, it's society, and it's heartbreaking that this is such an important part of our existence as humans. And we struggle so significantly. It's not just a baby comes out of our body, it's our entire body changes. And it changes forever, and it changes for a significant period of time once the baby is born. I think I've read that it's 2 to 3 years for a woman's entire internal chemical environment and sense of identity to return to what it was or what it could be postpartum. And to expect women to return right away to work it just simply doesn't make sense.
Yeah, 2 to 3 years stacked next to what many of us have come to know as like very generous maternal leaves of several months, a few months, couple of weeks, whatever it is that's provided and offered. So I'm hearing that there's so many different factors that are playing into why many people may feel the need to hide or underplay the ways that they're truly feeling about something. So I'm very, very appreciative that we're now talking about this so that other people can feel like talking about it is not the bad part. And if anything, talking about it can help. I mean, we love this word in therapy, right? Is normalize the experience, that you're not alone, that you're not the only one feeling this way. If anything, a lot of the people showing up and presenting themselves in a certain way, they might not actually feel that way. And I think that is even related to stigma. People may hide or underplay, or people may even try to actively present in contrast to what they're truly feeling. So what are some of the stigmas surrounding maternal mental health that you have noticed?
Well, the number one is, if I'm struggling or if you're struggling, then you are a bad mom. And that's just to feel like you're a bad mom when you're trying to be, let's say, a new mom, it makes it so much more difficult. It makes it so that you're not swimming through the waters of new motherhood or, having another child. But it's like you're trying to move through quicksand and wondering why you're not able to move as fast or as efficiently as other people. As much as I think it is important that we normalize the experience of the perinatal period and the postpartum period in isolation, I think it's important to realize that some women need to know that it's not like the most difficult thing in the world. And if it feels like it is, then there might be something more going on. And that's what's so important is I think that new moms, for example, or any mom that doesn't, isn't even aware of postpartum depression, postpartum anxiety, thinks this is just what motherhood is. And I just need to suck it up and deal with it. And it's yes, it's hard and you're not alone in how hard it is. And it's not just that you're weak and that's why it's so, so hard. There could be more going on. And that's why I'm glad that we're talking about this, because most people have heard of baby blues. They're like, oh, your hormones are changing, your life shifted right away. You have the baby outside of you instead of inside of you. And that's pretty normalized, saying, oh, the baby blues. But then if you go past that and you realize that there's more severe symptoms that can last longer and make your life far more difficult in terms of functioning and relationships, communication, it becomes a lot more clear to people that there's a lot more going on than, like I said, the baby is just born. Like, no, you are completely shifted from head to toe, not just abdomen, and you are for a significant amount of time.
You said something earlier about taking 2 to 3 years to return to how things were, but I think we know that it's not that it's returning to how things were completely, because now your identity is different. There's another person, if not more persons involved. And stigma, which makes it so difficult to talk about it openly or seek help, largely due to that feeling of, if I talk about it, then I might be perceived as a bad mom. Or maybe it's that I'm already believing that I'm a bad mom, so I don't really want to publicize that thing about me. Like, I think it could be helpful for people listening in on this now to hear a bit more about you on a personal level. You've already shared so much that you have been going through some of these things on your own, and you recently had a child while juggling a bunch of other stuff in your career. So on that personal level, can you tell us a little bit more about your journey and what you were taking care of, how you were able to move through your own mental health challenges during and after pregnancy?
Yeah, absolutely. And something that I think is really important is more and more people are coming to find out that they have ADHD or they have autism or they are neurodivergent or have a different level of sensory sensitivity. And for me, what happened was my sensory sensitivity has been changing through my neurodivergent diagnoses over the years. Just that happens as humans become more sensitive. People that are neurodivergent become more sensitive as they age. So I think it's important to note that neurodivergent individuals who become pregnant or individuals who have intense sensitivities and become pregnant can have such a wildly different experience of pregnancy than the average person. And so my first experience was really grappling with how much I could feel everything happening in my body throughout this pregnancy, more so than I could in my prior one. And I think that that's an interesting point to make, that most people who haven't been pregnant or don't take the time to really connect with those who have been realize that it is something that you feel every second of every day within you. So I got really overwhelmed sensorily. I also did IVF, which had a lot of injections, which was very difficult, along with the emotional turmoil that comes with that. And I experienced really, really bad morning sickness, which makes it really hard to function. And for most people that get pregnant that are working, you don't get time off while you're pregnant until at the end. And so for anyone that's having to deal with being pregnant and having morning sickness and managing your job, because you have a baby coming, that can be so overwhelming too. And that's actively what I was dealing with. This interview right now we're doing in the treatment center that I'm opening up in a week. But ideally, I wanted to open it last year. I was too sick. I had the worst morning sickness. I could not have prepared for how bad the morning sickness was, along with the traumatic responses from the IVF injections. So it was really difficult. And it got to the point where I experienced, it's called postpartum depression, but I experienced perinatal depression. I was severely depressed throughout my pregnancy to the point where I became suicidal. And I had never been actively suicidal in my life before, but I had dealt with passive suicidality for 15 years. So that's something that I think is so important to mention also, is that these postpartum diagnoses, postpartum depression and anxiety, they don't only take place postpartum. Prior to this diagnosis, you know, in the DSM, it's a perinatal identifier that's added on to major depressive disorder. And so it can occur any time in the period that you mentioned, during pregnancy or after birth. And it was very overwhelming. And I appreciated experiencing it because my first pregnancy was so easy that I didn't have the insight or the understanding of how bad it could be. And of course, you can hear stories of other people, even for people listening right now, they're hearing my story, so they may get a little more insight into it. But it can just be so devastating, especially to feel that way in moments where you can see people having really the time of their life during pregnancy, loving it. And the comparison isn't helpful, but it's almost unavoidable because that's what we do as humans, is we see what we'd like so that we can go and get it. And when we feel like we can't get it because we're trapped in our body and it's reacting the way that it's reacting, it can take us to a place where we feel really, really stuck and out of control. And that's why I wanted to talk about this today, because one, so many people don't understand it. So many people judge it and stigmatize it, say people are bad moms or incapable, or they feel that way themselves. And it can get to a point where if you don't realize that it can be a very serious illness that's happening in your brain and your body during this period, then you can get to a place where your life is at risk.
Thank you for sharing so much of your experience there. And I have a hard time imagining now. So I would love to hear from you. Like, what were you doing then to get through it? It sounded so difficult, sounded so overwhelming. I understand that some things had to be put on hold. Things didn't go as planned. And I also appreciate you bringing up your journey very briefly with IVF. That's like another part of this conversation that I don't think we're going to really get into today, but there's a lot of shame and stigma associated with this journey that people don't talk about it very much. Would love to hear more about IVF from you if you're willing to share. If not, totally understandable in this interview. More curious about if you have any specific coping tips or like things that people can think about if they're also experiencing that overwhelm, also experiencing all these physical symptoms that feel so painful. It could be that they are now having suicidal ideation, as you have had. How do people get through that? Now we know it's not so uncommon to experience it, but any concrete tips for people here?
Yeah, well, thank you for asking. And, you know, a little bit about IVF. I don't suffer from infertility. It is my husband who does. And so for me, the most emotionally overwhelming part for me was having to be the one to do the injections. I have fear and trauma around needles. I'm hyper sensitive, and I don't like feeling out of control. And I did with all of those things with IVF. So it was it's hard because the IVF process isn't easy for anyone. And to know that you have to go through it to have a child, if you want to have a child with your partner, that is the two of you mixed together, then you have to go through this. And the likelihood of it being successful is so low. And, you know, I think it's something I just had to not think about. The success rate, and I had to do the best I could to really shut it out. Now, I have other mental health diagnoses that have unfortunately afforded me the ability to very easily dissociate on cue when I need to, for extended periods of time if I need to. And so, you know, I was getting injections every morning and every night for 4 months straight, big, long needles in my back. And I had to just dissociate as much as I could. And for those listening that maybe don't have as much of a messed up mind as I do, so dissociation isn't something that you can turn on and turn off. It's really about relaxing your body as much as you can if you can't disconnect from it, reminding yourself that what you're doing is you are attempting to create your family, and that if the outcome isn't what you'd like it, it doesn't mean that it was you. you are such a small percentage of all of the variables that contribute to the success or non-success of IVF. It's so hard because you are only such a small variable. And for others, it's as easy as, trying in bed with your partner. And it's a much more enjoyable experience for many people than going into a doctor's office. It's feeling very sterile. It's feeling completely out of your control. And so I just sympathize with everyone who has to go through that. It's not easy. And regardless of whether you go through IVF or not, if you find yourself in a place where you are feeling suicidal and you're feeling really down and you have responsibilities, maybe other children, maybe multiple jobs with multiple children, and you still find yourself creating another life within you, what do you do? For me, I know I have many privileges for where I sit in society, what I look like, and the resources I've been able to accumulate over my career. And I would have to say that outside of all of those things, for anyone who doesn't have all of these things, a partner is the best way to get through it. And oftentimes, the partner doesn't quite understand how intense it is, the experience that their loved one is going through. I would not have survived if it wasn't for my partner. And I'm lucky because he gets to stay at home. So he's always there for me to support me and give me what I need. And for people who don't have that luxury, if you're a partner listening, be with your wife, with your partner, with the person that you love that's pregnant, and ask them how they're doing. Sit with them. If they get angry, if they get anxious, if they don't feel good, remove judgment and realize you don't know what they're going through. They can explain it to you, but you'll never really know. And so you always have to stay curious. You always have to ask questions, and don't assume that you know what they're going through or what they need. Even if you know what they needed and what they were going through yesterday, you still need to check in with them every day because it changes throughout the pregnancy experience.
Appreciate the tips for the partners and those that can be supportive to the pregnant person in their life. I have a hard time, again, imagining what somebody that's experiencing so much physical discomfort, that's getting to the point of not even being able to think clearly every day, what kinds of things can someone like that be trying to do to incorporate self-care tips, like the things that we're thinking about normally when we're not pregnant, can be very difficult to access sometimes, like exercise and eating healthy and being mindful of all these different things like sleep hygiene. Some of that stuff feels super out of reach. Any advice that you would give to those that are expecting or even recently having given birth and are having a hard time tapping into what we would recommend, which is self-care? Like, how do you do self-care when you're in this kind of space?
Absolutely. Well, we have to change our conceptualization of what it is that we need to do. So we know, okay, exercise is good for you. Physical movement is good for you. Every human on the planet has their own definition of exercise, of movement, and they have their own perception and perspective on what they should be doing. Not only what they should be doing, what they should be capable of doing or not doing. And so when you're in that space where you feel like you can't do anything, but you must do something, it's reconceptualizing those things. So exercise, for example, great thing to do for self-care. If you're devastatingly upset emotionally, physically suffering through your pregnancy, going on a 30-minute walk because you're pregnant and it's nice out, doesn't sound the best to you. It sounds unreasonable, uncomfortable. And so it's allowing yourself to reframe and redefine exercise and movement. Even if it's just very light stretching for 5 minutes because you're forced to be at work, and you just move your body in ways that you want to move it and that makes you feel relaxed. And it's not that, oh, I didn't do 30 minutes today. It's I stretched for 2 minutes today and created a little more space in my body. I also think that when we feel so out of control during pregnancy, which is a very uncomfortable feeling to feel, because there's times where there's thoughts of I wish this baby was not in my body. I wish it was just in a pod and it could grow in the pod and I could still be me. And so you feel so out of control. So it's also reframing what control is. How can you regain the perception of control in your body? And I've had clients who have felt so out of control during their pregnancy, and painting their toenails and their fingernails helped them feel more in control of their body. Being able to get a haircut made them feel more in control of their body. Changing their skin routine from just quickly washing it to giving themselves 10 minutes to sit down and put an extra ingredient, for example, on their face, something that is safe for pregnancy. There's ways to regain control of your body when you can't control other aspects of it. And there's ways to engage in self-care that don't look like what self-care used to be, as long as you allow yourself and give yourself permission to change those concepts in your head. And it can be difficult to do, but you will stay stuck until there's some type of shift there, because you'll always feel like they're unattainable goals and you're always out of control and stuck. And when we redefine that, you get a lot more permission than you think you originally had.
Love that. Redefining and the idea of staying stuck because you feel like you can't achieve something, then maybe it's about recalibrating, revisiting this thing you're trying to achieve and put it into the space of somebody carrying and growing a child. So really, really appreciate that. And I think that could be extended as advice to anybody, right? Not just pregnant people, but people that are going through some kind of significant life change and feeling very stuck. Always worth a revisit or recalibration of what your goals are. What are the things that you're trying to get to? Thank you so much for those tips and that insight. And I know this is such a big topic, and we probably only just started chipping away at a bit of a tip, right? So before we wrap up today, I was wondering if there's anything else that you would like to add, any really important tidbits that maybe we missed, I didn't ask about.
I think it'd be really important to talk about the difference between baby blues and postpartum depression, so people have just a really clear idea of what to be looking for. And I think when I think about my experience with my second pregnancy, of course, it was the extreme side of postpartum depression. But what was helpful for me was being able to be aware of what I was supposed to be looking for. Now, baby blues do take place postpartum, but postpartum depression can take place prior to that. So knowing the difference between what it typically feels like right after you give birth and for the first 2 weeks is important. And then knowing what to look for after that, if it's getting worse or lingering, that's really important too. I'm still in the phase of seeing if I'm going to experience an increase in postpartum depressive symptoms. And I'm able to actively assess myself enough to know when I need to go talk to someone. And so I want to give those tips to the audience, if that would be all right.
Yes, please.
Okay, so I think the first thing to pay attention to is, let's talk about the actual postpartum period after birth. Baby blues happen either right after birth or within a few days after birth, and they typically last for about 2 weeks. This is because there's adjustment in your home, adjustment in your body, and getting to know how your baby functions, how it sleeps, how it eats, its temperament, and you start to hopefully develop a bond. Ideally, it can be difficult if you aren't feeling okay. So those are baby blues, high level. Within the 2 weeks, they start and resolve on their own. What are the symptoms of baby blues? Mild mood swings, sadness, some difficulty eating and sleeping, difficulty concentrating, general fatigue. All your systems are a little lower. It's a little harder to connect with your environment and stay focused. And you're having, changes in how you eat and how you sleep. That sounds like somebody just gave birth and had a baby. Now, when does it move from baby blues into postpartum depression? It's when those symptoms that I just described get significantly more intense and last for longer than that 2-week period. The way to know that it's depression and you need to talk to someone about it is if you don't see any of those symptoms that I just mentioned resolving on their own. So in the beginning, if you don't sleep when your baby sleeps, like that common tip, that's normal. If you can't eat when you're not feeding your baby, that's normal. You're still adjusting. But 3 weeks down the line, if you can't sleep when your baby is sleeping because your body can't adjust, if you don't have an appetite or an over appetite, If you still can't concentrate, you're feeling more depressed. One of the main symptoms of postpartum depression is this deep feeling that you cannot take care of your baby. You're just incapable. Everything's so overwhelming. And you start to feel like it's been 3 weeks, it's been 4 weeks. What's wrong with me? That's when people start saying that. What's wrong with me? I must be a bad mom. Why did I do this? And it's because these symptoms are getting so much worse. So, in summary, for someone, what to look for is baby blues are from birth to 2 weeks, and they're relatively mild and they resolve on their own. Postpartum depression, longer than 2 weeks, more intense symptoms, and they do not resolve on their own. Most of the time, it doesn't resolve on its own. And it's because most of the time women don't really know what's going on. They think this is a normal adjustment period and that they are the ones that are weak for being incapable of handling it. And that's not what's going on. There's so much out of their control. So really, that's the first thing. I think one takeaway for women, people that get pregnant, partners, is watch how you feel and how they feel at 15, day 15, day 16. Really see, has this been resolving over the 2-week period? Has it sustained, or is it getting worse? And allow yourself to look there, because you're not looking at whether or not you're handling it well or not. You're looking at if you're okay or not, because you just had a baby, not because you're good or bad at being a parent.
Thank you. And in these tips, I heard you mention a suggestion or recommendation for somebody to consider talking to somebody if these symptoms are worsening or not resolving in a certain period of time. What would you recommend people search for? Because I imagine, somebody might be searching for a therapist at that time and typing into some search engine, therapist with experience with depression. I don't know if that is the right thing. Like any advice on what people could be searching for if they're not sure what words to use?
Completely. So you don't want a therapist that just specializes in depression. And I mean, if they specialize in all various types of depression, then perhaps that would be a good therapist for you. Or if you have limited resources, right? See what you have available. You want someone that specializes in postpartum depression, because there are so many more factors and variables that make it different than just regular depression. Like the fact that from the neck down, you had a complete hormonal shift and just birthed a baby. And so you want someone that's going to understand the interpersonal relationship that you have with your partner or partners, or the intense workload of the mentality of being a mother that's single with multiple jobs. You want someone that understands what's happening to you internally and has a lot of experience of how to help you resolve that externally. So postpartum or perinatal therapist would be really important. And I also think it's important to note that, let's say you can't afford a professional or they aren't in your area at all, community resources can be really, really helpful too. There's usually support groups in many places that have new moms also that are coming in. There's also group therapy that's available that's sometimes a lot cheaper to just go into a group every week versus an individual session every week. And I would say that also, someone like me, for example, that has the resources to seek a therapist if I need to understand these diagnoses, I didn't really look at the discharge paperwork that they gave me that had postpartum groups on it, that they had the social worker that came in and offered, do you want me to check up on you a week from today? And I declined all of those services. I wish I didn't, even though I had all the resources available to me. And so for anyone listening, use the resources that are available to you at the hospital if you liked your experience, because there are a lot of resources that can be free through your hospital, and or they can know of a lot of resources or community resources that are free in your area.
Thank you so much. I think I said this before. We just started chipping away at the tip of a large iceberg of so many different subtopics that could come from this. And so much gratitude to you for being so open and vulnerable about your own experience so that others can know that they're not alone in what they're going through. Again, thank you so much. And congratulations on all the things that are going on in your life. Sending well wishes to your 2 little ones too. Really appreciate your time and your wisdom today.
Thank you so much. It's always a pleasure.
Thank you.